All right, in this explainer, we're digging into the Make America Healthy Again initiative. You might see it called MAHA. We're going to use their own reports and their own strategy documents to really understand how they see America's health crisis and, more importantly, what they think we should do about it.
Okay, so here's how we're going to break it down. First, we'll tackle the big paradox at the heart of American healthcare. Then we'll zoom in on the specific crisis the report is most concerned about. After that, we'll look at what they say is causing the problem, the four-part strategy they've come up with, and finally, how they plan to put it all into action.
So, let's start at the beginning. The entire MAHA report is built around this one huge, puzzling question about American public health. Why are we spending an absolute fortune on healthcare, but not seeing the results?
And this chart really just says it all, doesn't it? I mean, look at the United States, that cluster of red dots way off to the right. We are a total outlier. We're spending thousands more per person than any other comparable country, and yet we're at the bottom of the list for life expectancy. The report basically uses this as ground zero, the fundamental problem that everything else stems from.
So that paradox, spending more and getting less, it leads the initiative right to its central mission, what it calls an unprecedented health crisis that is facing America's kids.
And here's the number the report uses to define that crisis. A staggering 40% of children in the U.S. now have at least one chronic health condition. We're talking about things like obesity, asthma, developmental issues. The report makes a really stark claim that when it comes to chronic illness, today's kids are the sickest generation in American history.
Now check this out. The MAHA report takes that childhood health crisis and connects it directly to national security with this number, 77%. A Pentagon study found that's how many young Americans are ineligible to serve in the military. So the argument here is that this isn't just about individual health. It's become a national readiness issue that's closing doors for a huge majority of our young people.
And if we look at the breakdown from that study, you can see why. Now, almost half are disqualified for a mix of reasons, but look at the individual slices. Being overweight is the top single reason at 11%. Then you have medical issues and mental health. The report points to these as key and, more importantly, preventable drivers.
From national security, the report then pivots to the economy, and this statistic is a gut punch. About 90 cents of every healthcare dollar we spend in this country goes to treating chronic diseases, and here's the crucial point. Many of these are preventable. We're pouring money into an unsustainable system that just treats the symptoms instead of preventing the problem in the first place.
Right, so what does the report say is actually causing all this? It boils it down to four main drivers where it thinks we can make the most progress.
So according to the report, it's not just one thing. It's kind of this perfect storm of our diet, our lifestyle, the way our medical system is set up, and the government policies that shape all of it. Let's take a quick look at each one.
First up, the report puts a huge focus on what it calls the standard American diet. The argument is that our heavy reliance on ultra-processed foods is a primary cause of chronic disease, and it even claims that federal policies have actually encouraged the production of these foods for decades.
And here's where it really connects the dots for taxpayers. The report points out that a lot of people who get food assistance through programs like SNAP are also on Medicaid. So you have this cycle where public money helps pay for food that contributes to disease, which is then treated with, you guessed it, more public money. The report's bottom line is that this cost falls directly on us.
The report also takes aim at the medical research system itself. It raises big questions about financial conflicts of interest, a lack of transparency, and suggests all of this leads to what it calls over-medicalization. This trend of treating every problem with a pill, which it says is a huge issue, especially when it comes to kids' health.
Okay, so that's the problem as they see it. What's the solution? Well, the report doesn't just diagnose. It prescribes a pretty comprehensive four-part strategy to fix things.
So this here is the blueprint. You can see the ultimate goal, to end childhood chronic disease, right there in the middle. And holding it all up are four distinct pillars, each designed to attack the problem from a different angle.
Let's just walk through these pillars real quick. You've got advancing research, especially on things like nutrition. Then, realigning the financial incentives in our food and healthcare systems. Third is increasing public awareness with big education campaigns. And finally, getting the private sector on board. And if you want to understand the philosophy behind all this quote really sums it up. It's cited in White House materials that support the initiative, and it really gets to that food-first idea that runs through the entire strategy. The core belief is that food is foundational to health, and our policies have just gotten it wrong.
Okay, so how does a strategy like this actually happen? Well, the plan isn't about small tweaks. It calls for a fundamental shakeup of our government health systems.
The big idea here is to completely shift the focus. The plan calls for moving away from what it calls these costly, often ineffective treatments and putting way more emphasis on preventing diseases from ever starting in the first place. It's about moving from sick care to actual health care.
And a huge part of the plan is getting all the key agencies, we're talking HHS, the Department of Agriculture, the CDC, the FDA, to actually work together. The argument is that for way too long, they've been operating in their own little bubbles, and you can't fix a systemic problem that way.
And these are just a few of the specific actions the strategy document recommends. You can see they range from big picture stuff like reviewing corporate influence at the CDC and NIH, all the way to really practical things like launching education campaigns on whole foods and overhauling the official U.S. dietary guidelines.
So, to wrap up the diagnosis, the initiative doesn't see this as a simple healthcare problem that you can fix with more money or a new drug. It sees a completely broken system, a tangled web of food, research, and policy that are all misaligned and need a fundamental repair.
And at the end of the day, it all comes back to this. This is the primary focus, the main call to action. Everything we just talked about, the paradox, the causes, the 4 pillars, it's all aimed at achieving this one central goal.
So there you have it. That's the case as it's laid out in the MAHA documents, a very specific diagnosis and a really sweeping prescription for what's ailing America's health. And it leaves all of us with the big question at the heart of this entire debate. What is the right formula to build a healthier future?